So you can tell everybody, yeah, you can tell everybody. Go ahead and tell everybody. I'm the man, I'm the man, I'm the man. Yes I am, yes I am, yes I am. I'm the man, I'm the man, I'm the man.
Trisomy 18, also known as Edwards syndrome, is a condition caused by an error in cell division. Trisomy 18 occurs in about 1 out of every 2,500 pregnancies in the United States, about 1 in 6,000 live births. The number of total births increases significantly when you factor in stillbirths of pregnancies. It occurs in the second and third trimesters of pregnancy. The history of Edwards syndrome comes from a man named John Hilton Edwards.
He first recorded its details after publications of a letter he wrote, suggesting that a tentative detection of hereditary disorders could be achieved by application of the linkage principle, test material obtained by amniocentesis. It has just been introduced for the detection of diseases in the fetus.
Pediatrics was Mr. Edwards' specialty, and he was spending a morning a month at the Children's Hospital in Birmingham, England, when he recognized a potential chromosomal abrasion in a newborn. He called it trisomy type unknown. This was realized in 1960.
In Edwards syndrome, there is an extra chromosome number 18. It is a very serious abnormality that leads to severe mental and growth retardation, abnormalities in the heart and other organs. Deformed features include a small chin, cleft palate, a webbed neck, and flexed limbs such as deformed hands and feet.
These babies do not survive very long, and the majority don't make it past 6 months of age. Sadly, nothing can be done to change this. What are the symptoms of trisomy 18? Babies with trisomy 18 are often born very small and frail. They typically have many serious health problems and physical defects, including cleft palate, clenched fists with overlapping fingers that are hard to strengthen, defects of the lungs, kidneys, and stomach and intestines, deformed feet called rocker bottom feet because they are shaped like the bottom of a rocking chair, feeding problems, low set ears, severe development delays, chest deformity, slowed growth, small head, small jaw, and weak cry.
Causes. Cells in the human body contain 23 pairs of chromosomes that are inherited from the person's parents. And human reproductive cells, ovum cells in women, and sperm cells in men, each have 23 individual chromosomes, referred to as XS in women and XY in men, and a number of 1 through 22. The extra material from chromosome 18, obtained after the egg is fertilized, is responsible for causing Edwards syndrome.
Children with Edwards syndrome inherit an incorrect number of chromosomes. Children with the syndrome inherit 3, referred to as a trisomy, instead of 2 copies of chromosome number 18. 95% of children with Edwards syndrome have what is referred to as full trisomies, while 2% are due to translocations where only a portion of an extra chromosome is present. 3% of children with Edwards syndrome have what is referred to as mosaic trisomies, where the extra chromosome is there, but not in every one of the child's cells.
Diagnosis. The diagnosis of Edwards syndrome may be reached by the physical abnormalities that are characteristics to the syndrome. A physical examination of the infant can be shown R-type fingerprint patterns. For example, while X-rays can show a shortened breastbone, a more definitive diagnosis can be reached through karyotyping, which involves taking a sample of the infant's blood for examination of their chromosomes. Through use of specific strands and microscopy, identification of specific chromosome is possible, and the presence of an additional chromosome 18 is shown.
Edwards syndrome is something that may be detected prior to birth of the child. Potential testing includes maternal serum alpha-fetal protein analysis or screening, amniocentesis, ultrasonography, and chorionic villus sampling. A woman who is pregnant with a child who has Edwards syndrome may have an uncommonly large uterus during the pregnancy because of the presence of an extra amniotic fluid, and usually a small placenta may be noticed during the birth of a child.
Prognosis. The majority of children who are born with Edwards syndrome do not live past their first year of life. The average lifespan for half of the children born with this syndrome is less than 2 months. Approximately 90 to 95% of the children die prior to their first birthday. The 5 to 10% of children who do survive their first year experience develop some disabilities. Children who live past their first year require walking support, and their ability to learn is limited. Their verbal communication abilities are limited as well. Although they are able to respond to comforting and have the ability to learn to smile, they can also recognize and interact with caregivers and others. They require some skills such as self-feeding and rolling over.
Inherited. Most cases of trisomy 18 are not inherited, but occur as random events during the formation of eggs and sperm. An error in cell division called non-disjunction results in a reproductive cell with the abnormal number of chromosomes. For example, an egg or a sperm cell may gain an extra copy of chromosome 18. If one of these atypical reproductive cells contributes to the genetic makeup of the child will have an extra chromosome 18 in each of the body cells.
Treatment. Medical science has not yet found a cure for Edwards syndrome at this time. Babies with the syndrome commonly present a major physical abnormalities, and doctors face hard choices in regards to their treatment. Surgery can treat some of the issues related to the syndrome, yet extreme and invasive procedures might not be in the best interest of the infant. The typical lifespan can be measured in weeks or even days. Treatment today consists of palliative care.
The lawnmower.